Whereas progress has been achieved in global health over the last several decades, millions of people still die each year from infectious diseases and other health challenges. Countries in the East African Community region are among top sub-Saharan African countries with the highest disease burden. Stakeholders in the health sector, led by Uganda National Health Research Organization, want regional domestic funding for health research. Unfortunately, today's health tools cannot accelerate progress towards universal health coverage.
We should have an enabling environment. An enabling environment in policy, in statutes, in legal aspects, an enabling environment in support, and also an enabling environment for the researchers in the region.
In the meantime, 80% of research projects received are health-related but donor-funded.
Within our funding framework, we also have funds that support research and development across the board. And health is one of those areas that we really emphasize. But at the moment, we are emphasizing those research outputs that have reached at a stage where they need to be tweaked a little bit so that they can be rolled out in the market, either in terms of products that are physical or processes or systems that are help us in delivery of health service.
Uganda is signatory to the Algiers Declaration, which tasks governments to allocate 2% of their national budgets to health research. These want East African community governments to allocate 2% of their national health budgets to health research and development, as well as creating a regional health research and development fund financed by 1% of GDP of each member state to support regional research and the East African Community Centers of Excellence. These strategies will be presented to the East African Heads of State meeting due this week in Kampala.
We want to talk to our own countries, our own leaders, our own private sector and other stakeholders to say, look, investing in health research makes a lot of sense, both in terms of turning around our health challenges as well as turning around our economics.
Currently, more than 80% of our response is funded from abroad, which is not sustainable. And we've seen a cut on foreign aid, which is threatening the response. So to be able to do that, we need to put in more money specifically for research to find out new innovations on how we can respond to the challenges that we're having.
In the 1950s, global health research and development investment of $26 million towards the polio vaccine resulted into cost savings of worth $180 billion, and now the world is on the verge of eradicating polio. Bernard Iga, UBC TV, reporting.